Topic for today is preputial prolapse of the bull. This is our cargo team. Let's start with the signalment. Khumsap is a bull of the species Taurus indicus, 100% American Brahman breed, male and body weight of 700 kg, body condition score 4 out of 9. The chief complaint is that the pupil is swollen, reddish, lacerated and prolapsed. Here is the farm history. There are 50 cows and 1 bull, all grazing freely in an open field without any concentrated feed supplement. Stray dogs have access to enter and exit the farm. All animals were vaccinated against foot and mouth disease and rapid skin disease once during an outbreak. On August 24th, the owner released the bull into a pasture with grass about 1 meter high and noticed that 1 cow was in heat. It is suspected that the bull may have molted for mating. Later, the owner observed swelling of the bull pupils and prolapse, so the bull was isolated in a separate cage. On August 25th, the owner administered prednisone 17,000 IU per kilogram and dexamethasone 20 ml via intramuscular injection. And on August 28 and 30, the same treatment was repeated as previously. On September 4th, the owner administered only prednisone 17,000 IU per kilogram and fed the bull with young grass. Additionally, the owner observed a deep wound on the right side of the pupils. And on September 5th, the owner arrived at Preputial Animal Hospital.
After a cow arrived at hospital, a physical examination was performed with the following results. All values were within normal range, except for the respiratory rate of 40 times per minute, which indicated tachypnea and lumen contraction rate of 3 times per minute. Lacerated wound on preputial mucosa at the right side with 2 cm deep and 7 cm long, but it didn't perforate. Previous edema caused partial preputial stenosis. This caused a change in the direction of urination from normal, and urine color is normal. The stool was loose, showing signs of diarrhea, which is likely caused by consuming young grass, as it typically has a high moisture content. Specific problem list is an preputial prolapse with lacerated wound and diarrhea. The initial assessment begins with the issue of preputial prolapse, which is caused by congenital factors divided into anatomical deformity and breed susceptibility. Anatomical deformities such as loosely attached sheath, poor attachment of the sheath to the body, wide preputial orifice, and agenesis of atrophy of the preputial retractor muscle. However, we can rule out this problem because the cow didn't show symptoms from birth. And breed susceptibility such as Preputial Brahman beef master, since the cow is a Brahman breed. This issue cannot be ruled out yet. Let's take another look at the anatomy of the pupils. The issue with khumsap is in the preputial skin that has collapsed, referring to the anatomy in this image. The preputial skin should normally be in this position during the resting stage, but an injury occurs preventing it from returning to its original position.
The preputial prolapse, which is caused by the actual factors, divided into traumatic injuries such as breathing, walking, standing, grazing. Infection in East Bovine herpes virus 1 is the factor that can be resolved because the cow does not have the respiratory symptoms or eyes inflammation. And the last one is the functional derangement such as habitual eversion seen in full breed. It can be ruled out caused by the factor may present with intermittent symptoms, depending on the bone behavior and breed. Next is the diarrhea that may be caused by bacterial, viral, parasitic infections. Eating rapidly changing food or ingesting young blood might also trigger it. The other reason is metabolic disease like pancreatitis or digestive disorder. Next up is the initial plan. We will check the complete blood count, blood chemistry, bacterial culture, and drug sensitivity tests. And these are the complete blood count results. The white blood cell, we found that the leukocytosis and lymphocytosis and other parameters are within the normal interval.
For blood chemistry, CGT is higher than the reference range with other parameters in the normal range. So for revised assessment, leukocytosis and lymphocytosis may be from traumatic injury with possible secondary infection. And we already ruled out bovine herpesvirus and functional derangement because there is no related clinical sign. For elevated CGT, we can rule out artificial cause because we didn't use heparin tube for blood collection and rule out phenobarbital because there is no history of Pumsap taking this drug. The remaining cause can be from hepatobiliary disease and using of corticosteroids. And for revised problem list, preputial prolapse with ulcerated wound come from chronic inflammation and preputial trauma from breeding. Diarrhea come from young grass breeding. Leukocytosis come from lymphocytosis and lymphocytosis come from chronic inflammation. And preputial trauma from breeding come from breed susceptibility. So our differential diagnosis is preputial prolapse and traumatic injury or prepuce.
Next is treatment and follow-up. On September 5th, 2024, we gave dexamethasone phosphate 0.1 mg per kilogram IM. The wound has been dressing with normal saline and scrubbed with 4% chlorhexidine. Apply Unipred cream around lacerated wound. Fed with Pangolahine and kept calm in a dry stable. On September 6th, the wound has been dressing. We gave fluticid-mecomin 2.2 mg per kilogram IM and candy-strip long-acting penicillin G 7,000 IU per kilogram IM, Q 48 hours. On September 7th, the wound has been dressing. We gave fluticid-mecomin 2.2 mg per kilogram IM and furosemide 0.5 mg per kilogram IM. On September 8th, the wound was getting better, decreased preputial swelling. We gave fluticid-mecomin 2.2 mg per kilogram IM again, and candy-strip long-acting penicillin G 7,000 IU per kilogram IM, Q 48 hours. On September 9th, the wound has been dressing. We gave fluticid-mecomin 2.2 mg per kilogram IM and apply Unipred cream massage for stimulating blood circulation. This video shows how can urinate normally.
Further remarks. In case of diarrhea, a fecal examination should be conducted to check for parasitic infection, as this is a history of breathing imposture, which poses a high risk of parasitic infection. Additionally, there is no clear history of deworming. Further inquiry into the herd history is needed to determine how many animals have diarrhea, as well as whether there have been frequent cases of failed inseminations or abortions due to the suspicion of boviral diarrhea infection. An elevated GGT MSAR level may require follow-up blood test 7 to 10 days later to check if the MSAR level remains elevated after treatment, as it may indicate hepatobiliary disease. This is particularly concerning since the AST level is already at the high end of the normal range. And finally, if preputial prolapse persists and cannot be fully retracted, it may be necessary to perform a modified partial prostatectomy to ensure the animal can continue to function as a breeding bull. This is overall of modified partial prostatectomy. A. Intended incision, dot line, site, and location is cranial and caudal aspect of the section to be removed. of said suture. B. Circumferential incision. C. After imputation, recognize tissue to be reapposed in correct anatomical plane. And D. Closure is achieved using rapidly absorbable suture in a continuous fashion semicircularly from the distal stage suture to the cranial stage suture. In the 2021 Worldwide Reproductive Book by Maxwell, preputial injury are categorized into 4 categories. The condition of the pulsar responds to category 3. As described, this is severe edema of the prolapse prepuce with deep lacerations, moderate necrosis, and slight fibrosis. With the treatment and prognosis as surgery is indicated and the prognosis is good. More supportive care includes applying wound dressing, hoisting, and the area with cold water and bandaging around a 40 cm urine egress tube made from plastic garden tubing. A sling made from shade coat material was also placed to help correct the remaining edematous tissue. Thank you for your attention, and special thanks to all the Ruminant teachers.